Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. When we think about vaccinations and shots, we usually think about our children, our little people, but there are a lot of vaccinations out there that seniors may be considering as well that can keep you healthy and strong. So we're talking with Nurse Practitioner Kim Neely about this today. She specializes in geriatrics. There's a whole list of vaccinations we need to consider.
Yes. So some things we need to consider as we age: flu. We have our COVID, one's called DTaP or the TD vaccine, and pneumococcal vaccine, especially shingles, is a big one as we age.
Okay, so let's break that down.
Okay.
Start off with flu. A lot of people feel like it helps. Some people think it does not. So who needs to be concerned about this?
So flu, I think, is important for everybody. A lot of people feel like when they get the flu vaccine, they say, "Hey, I got the flu vaccine. It made me have the flu," and that's not necessarily the case. As we age, the flu vaccine, we want to do the high-dose flu vaccine because as we age, our immune system is weakened. The high dose is better, and time of year we get the flu vaccine. You know, we have some pharmacies that offer the flu vaccine in August, but flu season is normally, we want to say in October because when we get that flu vaccine, the longer it's in our system, the weaker the immune response is. So we want to get that as close to flu season as possible. So like, for instance, October when it comes to our flu vaccines.
Let's talk about DTaP. Okay. Well, I've thought about that for my children. I know they had it when they were small, but also for seniors.
Yes, and it's good for seniors. It's the tetanus, diphtheria, and acellular pertussis, which is whooping cough. So if you have, let's say, a senior who has a daughter that's pregnant, we want that vaccine because we're also protecting that baby as well. So that's very important to do.
Yeah, that is something to think about.
Yes.
COVID, we all know that, and a lot of people have done several rounds of it. When do you still need to pursue the COVID vaccine?
We should do the COVID vaccine. Should be done every year because nothing's 100% effective, but it can reduce hospitalization and death from COVID.
So it doesn't matter if you've had 2 already and a booster. You still believe that seniors should have that annual COVID vaccine?
I feel like you look at that the same way you look at the flu vaccine.
Okay.
Every year.
So then we also have shingles. It's a whole other topic to talk about it. I know people have had friends and relatives that have had shingles, and they can be so painful.
Right.
And everyone's trying to avoid that. Who is this right for? Are there any, and when should you start having this?
So shingles is ready. Anybody should get the shingles vaccine. Even if you've had shingles in the past, go ahead and still get your vaccination. It comes in 2 doses. You do one now, and then you want to do your second dose within 2 months of the first dose. What happens is sometimes with that second dose, we forget, we don't come back. So as long as we get it, even if it's 6 months later, still get that second dose. We don't restart the series, but we still want to make sure we get both of those doses for shingles because it's 90% effective in preventing you from getting shingles.
Yeah, 90% effective is a good gamble to take, for sure.
Exactly.
So is there anyone that should not get the shingles vaccine?
Anybody that has allergies to any component of the vaccine should not be getting that vaccine.
Okay, so talk about that with your provider and go through all of those questions.
Yes.
And then, of course, there's the big new vaccine, new-ish, I should say, RSV. We know that, again, for babies and little kids, but it's been affecting a lot of seniors.
Your RSV vaccine, you talk with your provider. That's based on, that doesn't mean it's for everybody, but people with certain health conditions. So if you talk to your provider, they know your health status, and they could recommend that based on, let's say you have COPD or you're diabetic. There's certain people that get it. Not everybody needs to have that RSV vaccine.
It's an upper respiratory virus.
Yes.
And a lot of seniors have gotten very, very ill in it.
Yes.
Talk to me about what's the process of getting an RSV vaccine. Is it a one shot? Is it a series?
It's one shot, but it's, like I said, talk to your provider because it is shared decision making. Because you may not need it even though you think you may have it. You may be completely healthy. That may not be a vaccination that you actually need.
What about side effects of vaccinations? What should people be watching for?
So things like headaches, and pain at the injection site. Some people can have chills, fatigue, malaise. Those are normal side effects, and they can last 1 to 3 days after having the vaccination.
Should you call your primary care provider and let them know you're having a side effect? Or
only unless it's something that's abnormal. Let's say you develop hives. That's not a normal side effect from a vaccine. Please call your primary care provider.
Because they are responsible for reporting that.
Yes, 100%.
And it can ease your fears too that something is seriously wrong. Any final thoughts on vaccinations?
With vaccines, if there's any concerns that you have, just ask your provider. Definitely. Patients that have Medicare, there's annual wellness visits, and at those visits, your provider will go through everything that's needed, and vaccinations are one of those.
Yeah, so it's not something you check off after you finish school and when you're little.
Right.
We still have to have that second round when we get to be real grown-ups.
Exactly.
Okay.
Yes.
Kim, thank you so much for your time. A lot of great information to share with people. I appreciate it.
Thank you for having me.
Thanks for being here for Monday Health Minutes.